And welcome back to the Aging Well Radio Hour, heard every Thursday from 9 until 10 a.m. right here on WENG. Well, at least the last 3 Thursdays of the month. I'm so glad you're here. Carrie Black with you, and we're talking about wellness. We're talking about pain this hour and how you can get rid of it. Muscle pain, a major medical problem for about 60 to 85% of the population, who report experiencing nonspecific back pain of muscular origin at some time in your lifetime. Yep, I'm there, right there with you. Dr. Joesph Pergolizzi, doctor out of Naples, and an internationally renowned pain specialist, well-versed in multiple issues confronting people experiencing acute and chronic pain, has certainly been in high demand since the coronavirus has made its rounds. He's with us this morning. But viral infections are only one reason you could be experiencing muscle aches and pain. Other common causes include overexertion and trauma to the body. Are you a golfer? Are you a tennis player? Yeah, you're probably overexerting like I am. However, it's the lesser known causes of muscle pain that people may be unaware of and could confuse with symptoms of a virus. And Dr. Joesph Pergolizzi joins us this morning. Hi there. How are you?
Outstanding. Thank you so much, and hello to everybody.
Yeah, so glad you could be on. We like aging well. We like staying young, looking young. We try to do everything we can to do that, don't we?
Yes, we do. And it's very important that we're really focusing on our whole health and well being.
Absolutely. So, reading a little bit about you and the press release. So, you've seen an increase in patients reporting and experiencing pain since the start of COVID-19. Why is this? That's weird.
That's a great question, and I get this a lot. What's important to realize is that when your body fights a virus, the immune system works to fight the infection. This infection could lead you to feel muscle inflammation and weakness. We call that myositis,
Mm.
or joint or muscle pain, which we call myalgia. So, acute viral myositis, that's a lot of words, but that's a virus, right? It's a rare condition that occurs during the recovery phase of an illness, most commonly influenza. And it's
Mm.
characterized by muscle pain and weakness, and sometimes abnormal lab values. Infectious and post infectious reactive myositis, that's inflammation and pain of the muscle, can occur during and after some viral infections. Even after the virus is gone, the immune system may cause inflammation in some parts of the body for a
Mm.
few months. And symptoms are similar to broad muscle pain and weakness around the body.
Mm. Wow. So, let me ask you this and putting you on the spot. So, having a virus such as coronavirus or the flu, can that actually cause more muscle pain?
Correct. That can cause more muscle pain. And it may be part of those unusual sources of muscle pain.
Mm.
And this is a really good question because what are some of the unusual sources of muscle pain? Well, stress, dehydration, not getting proper nutrition, and lack of sleep. So think about it when you're suffering from a virus and you're feeling really sick,
Hmm.
all four of those are at action at once.
Okay. So for those of us that are active, we're playing golf, we're playing tennis, we're out walking, we're walking our dogs. We try to be in shape, but when you get a virus, it's more important for you to kind of recognize and when you have more muscle pain. That's interesting. I never knew that.
Well, certainly, and you're not alone. Many people are going to experience this type of pain. And what's important to do is also look at the distinction between acute pain and chronic pain. As we get older, we're going to see different types of pain, like 50 shades of gray, right? There are 50 shades of pain,
Okay.
right? And so, it's an important distinction because acute pain happens quickly and goes away when there's no longer the cause. But chronic pain lasts longer than 6 months and can continue even when the injury or illness has been treated.
So, what is the difference in acute and chronic pain? So, like an acute pain is when I'm on the tennis court, Dr. Pergolizzi, and I twist my ankle, and then that's pain, and it's going to go away in a few days.
Right. Now, let's look at that. Let's say you twist your ankle. That's acute pain your body's going to react to it like an alarm in the house to tell you, hey, stop walking on that ankle, it's hurt, right? That's why we do that.
Mm-hmm.
And now, over time, if that ankle twisting does not go away, the pain over after you've taken time to relax and heal and maybe have some pain medications, then after a 6-month period of time, you still have pain. That's chronic pain, and
Oh.
that's a problem.
Oh my. That sound yeah, and it hurts. It's not. So do all viruses cause pain?
Not all viruses cause pain, but I can give you an example of a couple viruses that cause pain, or at least one that all of us can, I think, relate to. Chickenpox, right? When we're young, it's not uncommon that we may experience chickenpox, and then as we get older, and we have times when our immune system is stressed, we can reactivate that chickenpox virus that lays dormant in our body. And we can get a syndrome called shingles. You may have heard of
Ouch.
that before. Yep,
Ouch.
ouch, exactly. And that's a virus, and that's a virus being
Oh.
reactivated and hurting your nerves and causing that pain. Now, that's acute pain, shingles. But what happens in some patients is that it lasts longer than the normal healing period. And that
Okay.
becomes what's known as post herpetic neuralgia, or PHN, and that's chronic pain. And all of a sudden now your system, Carrie, is supercharged so
Mm.
that even light touch can be painful.
Wow. I know. I know when I do have muscle pain, it's like my skin hurts. That's so weird.
Yes, it's those type of sensitization, we call it. Another sort of big word, but not to be afraid of. It just means that, you know, now your body is more sensitive, right? When you have chronic pain, and it's
Okay.
reacting to that pain differently. And that's why we get these exaggerated responses of pain when we have chronic conditions.
Okay. So you know what? When I when I have the pain as we get older, we get more pain. Dr. Pergolizzi, it's like we get more and more pain. So do you think it's a good thing to have an Epsom salt bath? Maybe do some stretching and things like that. What are some effective ways that we can alleviate that muscle pain on our own that does not involve taking pain pills? I don't want to take pain pills.
You bring up a really good question. And there are some effective ways to alleviate muscle pain on your own that don't involve taking pain pills or seeing a doctor. But I
Great.
will say this, I will tell you this: if you have a lot of pain, or if there's swelling and fever and irritation at the site, you should go seek medical care. But if we look at those effective ways to alleviate muscle pain that you can do without taking pills or seeing a doctor, they include pain relieving exercises, taking a break and stretching,
Mm,
and don't forget natural topical pain medications, because most people, when they think about pain, we automatically reach out to the over the counter pain pills.
yep.
But the label tells you that there's a limit to the amount you can take and that there are certain side effects. And if we look at topicals, it's important to realize that with topicals, when you have pain in the joint, or pain that's close to the skin surface, like your knees and elbows, you can absorb topical pain relievers relatively quickly and show positive effects, usually faster than something you take orally. Also,
Mm.
and also
Hmm.
you can use another dose much more quickly than you can take a second dose of most oral pain medications.
Yeah, and you know what's true? I was just playing tennis this week with my partner, and she said, "Oh, I tweaked my knee, and I'm taking a leave every 3 hours." And I thought, "Girl, you need to get a topical thing. That's hard on your liver."
Yeah, your liver, your kidneys, and
Yes.
you're absolutely right, Carrie. You bring up an excellent point. It's always important that you understand that there are what we call on target and off target effects. On target effect: when you have pain and you take a pain reliever, you
Mhm.
want pain relief.
Yep.
Off target effects are exactly what you just mentioned: problems with your liver, your skin, your kidneys, bleeding. These are different type of things we have to keep in mind. And we have to be very careful when we take these medications, particularly when we're self-medicating.
Okay, that's true. So maybe some, some topical creams are good, and they do they work quicker than taking pain pills?
Generally, they do.
Okay.
And another part of that question really is like, when should pain medications be used for muscle pain?
Yeah.
Well, well, when it hurts, especially when the pain interferes with your activities of daily living, the first thing you need to do is to assess yourself. And based on the severity of that pain, then you decide what may be the best way to go. And what we find is that topical pain medications, in a recent survey of pain doctors done at the largest pain conference in the United States, PAINWeek, showed that they would use topical medications for those type of joint and muscle related pains as first line therapy.
All right. Well, you know what? Is there a place where our audience can go and get more information about you? And what do you suggest that we do use instead of pain medications?
Well, first question, related to more information about me, you can visit www.drpergolizzi. That's DrPergolizzi.com, drpergolizzi.com, or
Okay.
healthydirections.com.
Oh,
And you'll see there one of the products that I've helped bring to market, which is a combination of a natural oil and a low dose of menthol. And what's really interesting is that that provides what we see as an unexpected event, in the sense that you can use much less menthol and get the same pain relief as a higher dose of menthol or menthol alone. That's really nice and leverages that desire to use natural products as well.
okay, great. Yeah, just in the first half of the show, we had Jimmy on from Remedy CBD and CBG, and that's another alternative that's not like a pain medication that we take. So tell me a little bit about, you said it was Instaflex?
Yes, the product is called
Tell
Instaflex.
us about it. Yeah.
And sure, so Instaflex combines low dose menthol with an oxygenated oil.
Mm,
And what we found when we combine the two of those is, first, that we have a nice, pleasant smell. It smells more like citrus or orange. And that's important because, sometimes your body reacts to certain smells. And I could tell you studies from major academic centers that if I put someone into an MRI machine and we have them smell, let's say, a product that reminds them of pain, then their brain shows like they have experiencing pain.
yep.
That's not good.
Wow.
Uh, right, exactly. The next, you mentioned tennis. So, if you're going to go out there and play tennis, you want something that doesn't have that greasy, oily feeling. So we thought about that too. And we made sure that this is rapidly absorbed. You just rub it in at the spot, and you can do that, up to 4 or 5 times a day as needed, because it's not absorbed into the body, right? And that's really important too, because
Okay.
as we grow older, we may take more supplements, or we may take more medications for different things that we have going on. So we don't have to worry about the drug interaction from the absorption, because it's staying in the skin. And then finally, what we found in our clinical study is that this combination allowed us to get really quick, good pain relief, and for a long period of time, better than menthol itself. So that's really encouraging.
Great. You know what? I still got to go back to the beginning of our interview because I am just shocked, and I'm loving learning things from you, that viruses can cause, such as COVID or influenza, cause more muscle pain. That is shocking to me.
Yes, this viral myositis, again, normally can be seen with something like influenza, and it's more rare. However, I've written a bunch of papers that have looked at the impact of this horrible pandemic and virus, COVID. And what we're finding is that patients are having both muscle, skeletal, and neurological problems. I'll give you one that you
Wow.
probably have heard about. When people say they lose taste or smell,
Mm-hmm.
that's your cranial nerves. That means something's going on with your nerve.
Oh,
People
wow.
don't see it that way. They think, wow, but the way you smell and the way you taste is based on your nerves that go in feed into your brain.
Okay.
Same thing with your muscles. When your muscles have to deal with what we call this sensitizing soup. Again, that's a big word, but let's break it down. You know, there's a lot going on. Your body's fighting this reaction,
Hmm.
and all of these immune mediators are coming out like oxygen free radicals, cytokines. The average person hears about this on TV and radio. And what you have to realize is now your body's taking on this additional burden to fight that inflammation. And that's going to cause more stress on the body, more dehydration. You're probably not going to be eating like you should, and you're definitely not going to be sleeping. So back to those unusual sources of muscle pain,
Mm.
on top of the fact that your body's working really hard to fight the virus.
It's true. And I think you said it in the beginning of the interview, Dr. Pergolizzi, that you said it's kind of a whole total body thing that we need to look at. Our sleep, our diet, our stress level. It really is all so connected and intertwined, isn't it?
It really is. You may bring up a great point, and especially because down here, particularly in Southwest Florida, we're aging properly. And we really want to enjoy the fact that, we have good health and we have the ability to go outside, enjoy great weather, be with our friends, be active, like you said.
Hmm.
So we have to adopt that sort of overall wellness concept. And we have to realize that you can beat pain. There are options. You don't have to let pain overcome you. I suggest what's known as a multimodal strategy.
Okay.
Again, big word, we can break it down. Multimodal, meaning lots of different modalities, both pharmacological and non pharmacological together. Stretching,
Mm.
taking breaks, pain relieving exercises. There's a really great concept that Dr. Steve Sinatra talks about, which is called grounding. And basically, you just take your shoes off and you go walk out on the grass and you just walk around. and
Yep.
it works. It works.
You know what? I can't believe that you brought that up because I actually ordered a grounding mat for my office at home where I work most of my time. And I put my feet on that when I'm at my computer, which is many hours during the day. And my dog actually sits on it. Now, Dr. Pergolisi, it's that good.
It is that good. And I am so happy you are so far ahead of the curve. And it's things like that we share amongst each other that are going to allow us to overcome problems like pain. But remember, pain can be addressed. And as I said, when it's acute pain and it's topically being generated from muscles and joints, you want to think about natural topical products as your
Mm,
first go to.
absolutely. Well, Dr. Pergolisi, this has been wonderful. Again, give out your website. Where can our audience find out more information, please?
Certainly, the website is drpergolizzi.com. That's DrPergolizzi. I want to thank you so much. I'm always available for you and your audience. And everyone, be pain free and enjoy living down here in wonderful Southwest Florida.
Absolutely. Thank you so much. It was a pleasure having you on. You have a great day.
You too. Thank you.
All right. And if you're curious about what the grounding mat is, just Google it. Yeah, it wasn't very expensive on Amazon. It's just a little mat that actually has a connection and then you plug it into just a typical regular plug. And I guess what it is it gives you positive ions where we're mostly negative. You'll have to look it up. It's pretty cool. Just look it up. It's a grounding mat and my dog actually, I don't know why she's so attracted to it. It's just kind of cool. She's smart sometimes. All right. Well, I hope you enjoyed this show. We're going to wrap up the show next here on WENG. We're your information station for Southwest Florida. Thanks so much for listening to the Aging Well Radio Hour, brought to you by the Seniors Blue Book and Remedy CBD CBG. We'll be right back.